Welcome to Shadow Me Next. Today's guest is someone who's followed the traditional path, realized it didn't quite fit, and then had the courage to build something that finally did. Dr. Amiee Duffy is a board-certified family physician who spent years delivering babies, teaching residents, and practicing conventional medicine until she realized that normal didn't feel normal for her patients anymore. And it certainly didn't feel normal for her. What I love about her story is how honest she is about that movement, the frustration of 7-minute visits, the patients who were still tired and unwell despite normal labs, and the quiet realization that medicine had to start looking deeper. In this conversation, Dr. Duffy takes us inside the world of integrative and functional medicine, the 2-hour visits, the deep dive labs, the gut health revelations, and the radical shift from treating disease to restoring life. We also talk about motherhood and training, the realities of shifting career paths, and the one disease process every pre-health student should be paying close attention to. This is Shadow Me Next with Dr. Amiee Duffy. Dr. Amiee Duffy, thank you so much for joining us today. We are so excited to have you on the show on Shadow Me Next. So thanks for being here. Thanks for joining us.
Absolutely. I'm excited.
If it's okay, Dr. Duffy, I'd like to do things a little bit backwards today because you have 20 years plus of healthcare experience. And there are so many phrases that we're hearing in medicine right now. You're a board certified physician. You're also the founder of Carolina Integrative Medicine, specializing in functional and integrative healthcare. Can you, for the students and for me too, can you define some of these terms like board certified physician? What is functional medicine? What is integrative healthcare?
Yep.
What are these things?
Well, board certified. So, if you decide that you're going to go to medical school and get your MD, then you can go to 4-year med school and you have an MD at the end, but you can't do anything with that. You could go be a secretary somewhere, but from a medical perspective, you can't. So then you need to go do at least an internship to get licensed to be a medical doctor. And there are occasional, you might find somebody working in urgent care or something like that just did their 1-year internship and has a license to practice medicine. But in order to be board certified in a specialty, so generally you're going to be board certified in family practice, internal medicine, pediatrics, surgery, whatever, orthopedics, OBGYN, that's a board certification that you get after you complete a residency program. And then to further define, so I am board certified in family practice or family medicine. And then there are entities out there where you can get a board certification in functional medicine or in, there's A4M is the American Association of the Advancement of Anti-Aging Medicine or something like that. So it goes on and on, multiple A's. You can be board certified in something like that, although you don't have to be to practice that type of medicine. So integrative medicine to me, which is why I've started this and named my practice Carolina Integrative Medicine, is the idea that we can bring what we call our traditional allopathic, MD medicine. So it's you have this, we test you or we guess or whatever you want to call it, and here's your pill kind of thing. Where integrative medicine brings in other thought processes, I guess. So it's we're integrating different modalities. So whether that might be accepting of massage therapy or acupuncture or, talk therapy or physical therapy or whatever, we're integrating multiple modalities into the patient's care so that we're going to get better results than just kind of, streamline here. And often integrative and functional are somewhat mixed. And the more, I opened my practice 15 years ago and it was integrative medicine. And then really I practice functional medicine now, but I just didn't change the name. So functional medicine really kind of, the theory is that it digs down a little bit deeper. What is the actual physiology going on? Let's repair the dysfunction that's happening in our body. So if somebody's having a lot of fatigue, streamline can be, okay, you have a thyroid disorder and we're going to fix that and then we're all done. But, you can really dig a little bit deeper. Well, why did that thyroid disorder happen? Or, okay, you have fatigue, but your thyroid is normal. You don't have sleep apnea, you don't have some other things. So what is causing that fatigue? And we really get deeper to say what's stressing out the system. And so in functional medicine, we often will do some functional labs, we're looking at saliva testing to look at cortisol and adrenal function and hormones in a different way. We're looking at stool testing, not just like your typical stool test if you went to the ER or something like that would be like, do you have the bad guys? Is there E. coli or salmonella there, right? But this
Right.
really like is a very broad 8-page, report of all the things that go on in your gut. And not only, are the bad guys, but are there enough good guys there? And so, it's really a detailed lab. You can look at the, leaky gut. A lot of people think is kind of a fad term, if you want to call it. There's actually
Hmm.
markers that you can measure for that. Digging a little bit deeper from a cardiovascular perspective, you can see inflammation, you can see plaque activity, you can see kind of sticky factors. So, we're really looking way deeper than sort of traditional medicine, and not that those doctors don't know that those things are out there, but a lot of it is what is insurance going to cover? What do we have time to talk about? Because in sort of a traditional medicine, it's like we got 7 minutes to see this patient. So we don't have time to be talking about all these labs and the results, right? But, a new patient for me is often a 2-hour visit to go, through all of that stuff. So in a nutshell, there's board certified and then there's extra. And, I'm not, I have a few certifications in like hormone balancing and things like that, but as I go through, I'm just practicing in family medicine. You sort of have a pretty broad scope of what you do. And so you're not required to be board certified in, something like functional or integrative to practice that. If I decided I wanted to go do surgery, then I would have to go back and get, board
Mm.
certified to be um, in compliance, with like I'm not in a hospital system, so I don't have to, you know, have certifications for doing things in the hospital or something like that. Does that make sense?
It does. That is so interesting. And thank you so much for defining those terms because I think, like you said, so many people are throwing these terms around and we're using them now colloquially and
Yeah,
professionally. And I'm not entirely sure people fully understand exactly what they mean.
right.
So thank you so much. It's so interesting to me. And I would love to hear your story about how you transitioned from conventional medicine. So that's the allopathic medicine that we talked about. Here's your disease, here's your treatment, moving
Hmm.
along into this more really whole patient, whole healthcare um, practice. Were you becoming more and more frustrated with the medicine, or were you realizing that your patients weren't getting the answers that they
Yeah,
needed?
probably both. I think, lucky for me, I'm very grateful that it happened fairly early in my practice. So, this goes way back. When I was 11, I just absolutely loved babies and I wanted to hold all the babies and I had all the Cabbage Patch dolls and all of their accessories and everything. So I became a babysitter at 11 years old. And this family, I never, I was more like a family's helper. Like I just came over and played with the baby so the mom could get stuff done, basically. And as I grew in 11 and as their family grew, I mean, by the time I was a senior in high school, I was part of their family. Her sister had babies, her friends had babies. I used to babysit all the kids and all that. And that was my job for years. And so when I was a senior in high school, um, they were having another baby and invited me to be in the delivery room to experience it. And so
Wow.
that was my first true sort of medical, you know, experience besides just me going to the doctor. And I was just fascinated. I mean, I was kind of up, I wasn't down in the business end, I was up at the head end. So, I didn't see everything, but baby's born and put on mom's belly. And I was like, this is the coolest thing. Like, I want to do this. So I knew that I was going to go to med school. I thought about PA school a little bit, that sort of thing, just because I knew I wanted to be in medicine, but I wasn't quite sure what that was until the OB experience. So I thought I was going to go be an OBGYN or I was going to be a midwife. I didn't know which one, but went off to school and then in residency, a couple things happened. I had not residency, I'm sorry, medical school. I had a baby my third year of resident or medical school. So baby number one came. I have four
Whoa.
girls now. Um, I wouldn't advise that, but if it happens, you can cry because that's important to cry a lot and then realize like, my advisor when I went in, I was like, what am I supposed to do? Like, And he said, this is not the first time this has happened, number one, and you have 7 years to matriculate through medical school. So, like, you can take your time, figure it out. So I actually did take a whole year off when she was born because otherwise you were just going to be delayed and not be able to match anyway. So, like, why don't just take a break, just jump back in with the next year? That was aside. So when I was in medical school, going through the rotations of different specialties and family practice like was just so calm and everybody was just really happy, where when you get into kind of the surgical specialties they were all like it's just like what you imagine residency being. And it might be better now because we have new rules, I guess, with the 80-hour work week and stuff like that, so maybe more people are calm. But so what I realized is that family practice could do a lot of things, and they could deliver babies, but they could also take care of the babies afterwards and be able to do more women's health and then have their own babies and seem to have a little bit more relaxed schedule. So I did family practice, and I chose a residency program that's here in South Carolina because they were very heavy in obstetrics. So as you go looking as a
Cool.
medical student and you kind of, start to explore different residency programs, particularly in family medicine, they're all a little bit different. Some are bigger in like sports medicine if they're around a college or something like that, and others, may have more obstetrics. And so I chose a rural residency program. There's only 2 residents per year. I did a bigger internship at a bigger hospital farther away, and then came for my second and third year. And we're required to deliver 10 babies. And then when you're done with that, you could be done or you could do more. So out of the 4 residents that were, in my group, none of them wanted to do babies except for me. And so once they did their 10, then I got all of them. So by the time I graduated from my residency program, I had C-section privileges. I was delivering all kinds of babies. And so that was what I was loving, is being able to be part of that OB world and then take care of the babies afterwards. So I was invited to stay on as a attending physician at the residency program here. And I did that for 1 year. And then the OBGYN office next door said, why don't you come be over here? We need somebody to do primary care for all the women that are coming in because we don't want to do that part. We'll share OB call and then we'll do the surgeries and it'll be a nice blend. And I just jumped at that. I was like, yes, more
Cool.
babies, more delivering. I was so excited, and that was perfect. And the two things that changed there is that in residency, I had 2 weeks of a GYN rotation. So, I was focused on babies and moms and whatever, and I didn't talk to anybody about hormones, and menopause. And that was just not part of my world. And so as soon as I got into this OB world and I was seeing annual exams and I was primary care for all these women coming for their annuals, and like there was the hormone issue. And for the younger people, back in 2002, the Women's Health Initiative came out and basically made this huge deal about hormones bad, nobody can be on hormones kind of thing. So this was 2006. And I was right
Wow.
in the middle of what do we do with these women that are going through menopause. And I just wasn't really happy with, like, the lowest dose possible. We hope it doesn't, cause problems 10 years down the road, but we have no way to tell. We have no, risk factor modification or anything like that to give these women this medication that, could be harmful, but yet they're suffering through, the changes of the hormones. And so I happened upon a conference called Natural Hormone Balancing. And so I was like, well, let me go check that out and see what happens. That was 2008. And like, it was like Alice in Wonderland going through this tiny little hole into this amazing, beautiful world of bioidentical hormones and functional medicine, and sort of like digging a little bit deeper and really being able to say, okay, if this is out of balance, let's just bring it back to normal and, we'll feel better. And so when I started doing that, patients felt better, right? We weren't kind of weighing the odds of whether we can try this or let's just put you on an antidepressant, that'll make you feel better. And like it was, it was little baby band-aids that weren't really fixing the big
Mm-hmm.
picture.
Mm-hmm.
So I started doing that in that practice, and that was a private practice, all was great. Then, just like a lot of private practices come and they decide they're going to get bought out by the big hospital system, and I knew that that was not the path for me. So I amicably said I'm going to not continue on that path, and weirdly had a consultant who I met at a conference. They had a booth, and they were like, hey, we can help you with practice management and consulting. And I ignored them because I was like, I don't need that. and, call him up and be like, okay, what do I do now? And so he was like, you can do this. Like, you can open your own practice. We'll help you. And so, that's the start of Carolina Integrative Medicine 15 years ago. And just, I was very focused on the hormones, kind of adrenal stuff, getting into thyroid a little bit. And then what I found is the patients who came in with like gut stuff, they had IBS or whatever. And if we treated the gut, like exponentially, everything else got better.
Incredible. It's incredible. I am so glad that
Crazy.
you described your journey. First of all, thank you for doing that. But largely because it seems like you were really able to find what suited you. I think so
Yeah.
often people hear, well, people, so a lot of my pre-PA students will say, well, I don't want to go into medicine. I don't want to become a medical doctor because I don't want to work in X for my whole life. I like the flexibility of being a PA. And we've mentioned this on the show before, but time and time again, we're hearing these stories about physicians, specifically MDs, really getting to explore medicine in a way
Yeah.
that we might not realize it. So I'm so glad that you've been able to do that and find a bunch of different ways that you've been able to really feel comfortable and confident and be able to shift. I mean, we've heard about practice shifts. We heard about business model shifts and workplace shifts.
Mhm.
And then of course you really found what you needed and you've been there for so many years. It's
Yeah.
it's incredible. I'd like to talk a little bit about your patients. So in functional and integrative medicine, when your patients come in, is it a hard sale for them? Do you have to really convince them? Or are they mostly very open to what you're looking at, what you're looking for, and the next steps that you want to do?
Yeah. Um, it's twofold. We spend a lot of time in what our term is called pre-education. So, people are watching a lot of videos. We have webinars that people come to, that sort of thing. I used to do live talks pre-COVID, and that was fine. But once
Mm-hmm.
COVID happened, that was the one thing that was good out of COVID, is that we learned how to be virtual like this. And so it's
Yes.
like, oh, I don't want to go back to that. But so a lot of our patients are, if somebody was just searching, or looking for something different. I mean, these terms, integrative, functional, holistic, comes through a lot. Or hormones, specifically somebody looking for natural hormones. They might even not know the word bioidentical hormones, but something like that. So I would say the majority of our patients are searching for something different. They're frustrated with the typical system. I go in, I have 5 minutes, they just want to give me another prescription, and I don't feel good. And I'm on 10 prescriptions and I still don't feel good. And I'm not finding the answers that I'm looking for. So generally, if they're searching, it's not a hard sale because they're frustrated and they're there. And then, on the flip side, it's in the business world, we have to do some marketing, but I don't really like the word marketing and sales. If people don't know about us, we can't help them.
Mm-hmm.
So to
Mm-hmm.
me, it's getting out there and spreading the word. Just like that's why I like doing podcasts, because it's like, oh, I didn't know that was out there. Maybe I can go look for that. And then even if it's not me, but somebody else that can help this person, change their life, then I've done something. So it's more about getting the word out there to let people know that there is a different model and a different way of getting, taken care of and then living differently. Um, so most of our patients, I wouldn't say, we're not coming in, by the time they get to me, and, that's a whole business thing. We have discovery calls that they do first, and, we do all this stuff. So by the time they get to me, it's not like they just picked up the phone and said, hey, I need an appointment. Like there's a lot
Very
of work that
cool.
goes into that. So, then I'm able to explain to them what's going on with them, what are their issues? Where do they want to be? Here's what your labs are telling me. And, here's what my plan is. And so our plans are very comprehensive. We do wellness programs. So it's not, again, we're taking off this and we're saying we've got all these different pillars that we need to be addressing. And you're not going to get to your optimal self or place unless we attack all of these different things. And so that's going to take time, but it's going to take some structure to get there too.
Absolutely. You just answered another question that I was going to ask, and that was, what does good health mean? And really, I was hoping you were going to describe exactly that. The fact that it is not just going to see your cardiologist twice a year and making sure that your EKG and your labs look normal, right?
Right.
It's not just keeping your thyroid somewhat managed for whatever the standard is. What you're describing as good health is it's hormones, it's gut. You mentioned talk therapy.
Mhm.
It is so much more. And I'm so grateful for your practice and the care that you're providing these patients, because I think a lot of people are frustrated with medicine. Sometimes clinicians, sometimes. a lot of times clinicians are
No,
frustrated with
clinicians are, yeah, for
medicine.
sure. I mean, they're frustrated with, again, I think it takes a lot, and that's why I'm saying I'm grateful that it happened early in my practice because I'm not sure if I was 10 years in or whatever that I would have the capacity to, take a jump and make a big change like that. So, I get it, and I hear them all the time being frustrated, and that's part of the business coaching model is that we have a lot of practitioners who are getting out of, the traditional rat race of, urgent care or
Mhm.
ER medicine and transitioning to this, more functional or integrative approach and opening their own practices. So, um, it's very, I would say like I started this bringing life into the world with delivering babies, and now I kind of get to restore life to those who have been, sort of feeling like, is this my normal? I'm 48 years old, I'm 52, like I feel like I'm 80. What's wrong with me? And, traditional labs look normal. They can't see. Their kidneys are fine, their liver's fine, their thyroid's normal, maybe they have a little high cholesterol or something like that, but they're not looking deep enough to be able to see, what's causing that issue to make you feel older.
It might be a sticky subject, but it almost sounds like healthcare as opposed to sick care, which is what,
Exactly.
right?
Hmm.
I mean, that's what you're describing.
Yeah.
Which is I think what a lot of people want right now. I want to
Yeah.
go to the doctor and I want the physician to tell me I'm healthy. Goodbye.
Right.
See you next time, right? But if I'm not, I don't want just a band-aid. I want to get to the bottom of it, like you're mentioning.
You want to
You've
feel
mentioned a
healthy too, not just be told you're healthy, right? But you want to feel like that. What does that mean? That means I can jump up out of bed and I can do all the things that I want to do. I can get down on the floor. I can stand up. I can run if I need to. I can get through my day. My brain is focused. We see a lot of, just my brain, brain fog. I can't remember things. Do I have adult onset ADD? And again, there's band-aids for that, but that's not the reason why, you're feeling the way you feel. So,
have you seen a big uptick in interest in this recently?
oh yeah.
Is it because people know more about it? Is it because people are frustrated? Is it because of COVID and the fact that we all now think we do have all these strange, bizarre symptoms that are happening and we
Yeah.
need somebody to tell us
I
what's going on?
don't know if you could I could put a finger on exactly the why behind it, but I definitely think that it's growing. Um, interestingly, like that, the A4M I was telling you about, that's a conference that I attend and speak at. And last year, I think they hit a record of like 7,000, attendees at this
Mm.
conference. It's huge. It's a convention center in Las Vegas. They started at like 700, so I mean, just over the, whatever, 15 years. And that's why I was talking to somebody yesterday and they're like, so you were doing hormones, bioidentical hormones in 2008? I'm like, yeah. And they're like, we didn't even really know that existed for a long time or it's really coming out there. I would say in the last 5 years, it's definitely growing. And one of the things I think, I mean, just like we're doing now, right? Like these podcasts are huge. Like that is, podcasts, social media,
Mm-hmm.
YouTube, people are out there and talking about this stuff. And prior to that, like how would we have known? Nobody listened to podcasts before, and we didn't have YouTube videos really, or that wasn't the place where we would go to get information. So I think, to some degree, it's technology that has helped us get the word out there, for sure. And then just again the ability of having AI is just a whole nother thing. I mean, people are searching, but even 2 years ago, we didn't really know that. And so, people could Google search and I think the algorithms for searching, for information, has improved too. So that when people search, why am I tired? And, hopefully something in the world of functional medicine comes up for them.
Awareness is a beautiful thing, and I think for the people that are thinking about this and thinking, well, maybe I need to go see someone in functional or integrative medicine, but they might be a little nervous. They might feel like, well, I don't know where to start. You have this fantastic book called Normal Doesn't Have Side Effects. This book explains the proven scientific methods that you, Dr. Duffy, use to reveal and treat the invisible interactions, I love that, between each patient's hormones, body systems, and food. What questions are you hoping to answer with this book?
I think the biggest thing, like I described, is that we've got to put the blinders or take the blinders off, right? I think so many, even in the hormone world, people come in and be like, "Well, my hormones are off," and like I just need hormone replacement, whatever that might mean for them. And what I really wanted people to understand is that there are multiple things going on that can affect how you feel. And there are things that, like, again, your internal stressors of what's going on in your gut, and even if you don't have symptoms there can still be things that your body's job is to protect you. And if it's over here trying to protect us from all the chemicals that we're putting in our body, it's too busy defending us to be able to really do its proper job. And so I think so many people, if they don't have a true obvious symptom, when I eat this, I feel this, that they don't realize how much their food is affecting them, how much their gut health is affecting them. And then that turns into, how does that affect your hormones? People come in, I'm 38 years old and I'm having night sweats. Like, I'm too early to have, menopause. Like, what is this hormone thing about? And again, if they're all focused on hormones,
Mm-hmm.
they can band-aid that, but they're not understanding, why did you get to this place? And and so I really was hoping for an easy way. There's a lot of stories in there, so hopefully it's somewhat entertaining, to help people connect with the importance of managing stress, the importance of managing your gut and your food, as well as addressing, some hormonal imbalances and other inflammatory things. So, there's some fun patient stories in there. There's some personal stories in there. There's, stories about having four babies and delivering my
Mm.
own baby.
Wow.
Stressors that I've had with my own kids, and things that for a long time, as in medical school and we don't talk about our personal stuff. We don't talk about money. We don't, we're just here to take care of the patient, and we're like this, we're behind this, bubble or something like that. And to be able to really have good connections with your patients and have them trust you, number one, they're going to be more likely to do what you say. Um, from a business perspective, they're going to be more likely to invest in themselves and invest in me and trust that, I've been there, I've walked the walk. This is not
Mm-hmm.
me, over here saying you shall do this, right? It's like we're doing this together. So that was really the goal of that book, and to help people understand, the normal doesn't have side effects comes mostly from hormones. When I'm trying to say, if we can, your hormones are down here, and all I want to do is get them to here, and then we're not having to deal with all the scary stuff that comes from the pharmaceutical grade hormone replacement that got such a bad rap for a long time. So we're constantly having to defend the safety of hormone replacement. Um, so that's just one step in that direction.
It's such a hot topic right now, too. My goodness.
Oh,
It's an incredible book. It's a great resource for people who have questions, or maybe just want to investigate a little bit more before
yeah.
they dive into this world. So thank you for making that. Of course, it's available on Amazon. You can also go to Amiee Duffy, MD.com. That's AIMEEDUFFYMD.com. And if you're in South Carolina and are interested in Dr. Duffy as a patient, Carolina Integrative Medicine.com. Dr. Duffy, before we wrap up, I do have one more question for you, and this will be for our pre health students. Even if functional or integrative medicine is not on their radar right now, they have their blinders on and they're full
Yes.
focused on
Ready to go.
surgery. What is one topic that you are seeing so frequently in medicine that they should at least have on their radar right now?
I think gut. I think, addressing food and addressing the gut, and it's not very difficult. So anybody can do it, and it shows up everywhere. So if you're going to go into cardiology, let's make sure that this person's inflammatory, response and immune system is where it needs to be. Same thing, surgery, um, to me, like, that's our foundation. And because I think of our accessibility to chemicals, meaning our food has changed dramatically, and so many people have blinders on. Food is food. Why, we're just eating. Like, really, is that food fueling our system to give it the best result, or is it having to, bring the guns out and really have to fight through what you're putting
Yeah.
into your body? So I'm so sad, like in oncology, people go in to get their chemo and there's like donuts and packaged snacks and sugary drinks and whatever. And like we're just feeding cancer, that's my opinion anyway, not a medical diagnosis, but so it affects everything everywhere. So, and the sad thing is that in medical school, there's zero nutrition. At least where I was, I'm not sure how it is
Hmm.
20 years later, 30 years later now. So paying attention to nutrition and learning how to at least evaluate somebody for, some gut stuff can be huge and no matter where you are.
That's a really great point. Dr. Amiee Duffy, thank you so much for joining us today on Shadow Me Next. It has just been such a pleasure.
So fun.